The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, with my Houston surgeons. And on this episode of the Confidence Doc, we have the beautiful Iliana Torres. Welcome to the show.
Thank you so much. Thank you for having me.
So tell me a little bit about yourself. I know that you are IBT therapy, correct? Did I have
IBT
it correct?
counseling, yes.
Counseling. I'm so sorry.
Oh, no, that's
And
okay.
you're based out of Florida.
Yes, I am based out of Florida. I have a Winter Park address, but I work out of my home. So everything that I do is telehealth. And I think that kind of changed after COVID in 2020. And that actually helped me to start my private practice about 2 years ago.
And you have a very specific counseling that you do.
Yes, I am a licensed mental health counselor in the state of Florida, so I can see anybody for anxiety, depression, trauma, ADHD, things like that. But where my specialty comes into place is with bariatric patients. So, patients that want to have weight loss surgery or who have already had weight loss surgery and are having difficulties navigating the emotional and mental fallout, so to speak, from having that surgery. And I've been doing this now for about the last 2 years in my private practice, about 4 or 5 years that I've been trying to niche down specifically. And I really, really find it, I guess, just impactful, and just I really love working with that population because I too am not only a bariatric therapist but a bariatric patient. 9 years ago, I went through my own weight loss surgery and I lost about 200 pounds and I've kept it off. So it's really, really impactful for me and really important for me to be able to do this work.
And so it's something that's passion for you because it's part of who you are, right? So when you decided to go off on your own, like you said, and you opened this private practice, was this an area that you felt like there was a lot of, like there was a need there that wasn't really being met?
I definitely felt that there was. I always say that I have two jobs. One is my private practice. The other, for the last 3, 4, 5 years already, I've lost count. I do the bariatric assessments for a colleague of mine who owns a company that just does bariatric assessments for patients who want surgery. But I have branched out because I've been there, done that, and I'm also a licensed mental health counselor. I know that there are a lot of changes that come with just knowing yourself better and becoming more self-aware, but then adding that extra piece of medical and physical wellness and well-being. There's a lot that you have to unpack there. So I'm
Mm-hmm.
really thankful to be able to work with that population.
Do you share a lot with your patients about, like, do most of them know that you've been through this as well? How do they find you?
That's a good question. I always ask them when they either email me or call me. I'm like, "How did you find me?" Because I always wonder if Google works.
Yeah.
But it's some of that. It's EAPs, it's health insurance companies.
Mm-hmm.
But to answer your question, I do when it's therapeutically relevant to share with my patients what I've been through. If it matches something that they're going through and they don't know how to navigate, I can say, well, in my own journey, I've been there, done that with this. So not everybody knows. And I'm far enough removed from my old way of living and prior to surgery that not everybody knows now when they meet me that I'm a bariatric patient. They know I'm a bariatric therapist. Not everybody knows that I'm a bariatric patient. And when I realize that, I'm like, oh, okay, you're still new here. So when they do find out, it's like, okay, if they know me, it's either you know me or you work with me, and it's been therapeutically relevant for me to share something with you.
Got it. And that makes sense, right? Because you're really focusing on what you're how you're helping them heal and with their journey. What one thing that is I think is interesting because you have been a patient yourself as well is that what are your thoughts on when people choose to share that, right? Because, not everyone wants to share that they've been a bariatric patient or they've had skin removal or any of those procedures.
I really tell my patients it's up to them what they want to share and what they don't. It's really nobody's business. That's why they are protected by HIPAA. They never have to share anything if they don't want to. I tell them when they ask me, well, why did you share? I'm like, I have been a bigger woman the majority of my life. And if I was going to lose 200 pounds in a year, I wanted to be honest and authentic about my modalities of getting there. And then, the surgeries that came after that with skin removal and everything, I've been very honest about my journey just because I think not many people are. And it makes you feel, oh, I'm one of the very few that's going through this. I don't have a community around me who knows this. And I'll tell any of my patients who listen, I've been there, done that. Got the t-shirt and gave it to Goodwill already. So if you have questions, please ask because I will definitely, if it's therapeutically relevant, I will definitely answer them every single time.
That's wonderful. I think everybody needs a community, right? Nobody ever wants to feel alone with what they're going through. What are some of the challenges that you see? Because obviously everybody's an individual, right? So not every single person has the same experience when they're going through weight loss journeys. But what are some common things that you do find that you see before someone actually commits to having bariatric surgery?
A lot of times my patients wonder am I making the right decision? And I tell them, I can't really tell you if you are or not. If you've discussed it with your surgeon and this is something that is well within the treatment protocol and you feel comfortable that this is a change that you want to make, then absolutely let's get you to move forward with all of the procedures and let's get you, uh, qualified and certified for the procedure, for the surgery. Um, but I let them know that if and when you want to share, it is your own personal story. And I know that if I hadn't shared my own personal story, there would be some people. I'm not saying that my story made a difference to one person ever, but if I didn't share my story, then there would be other people out there who would still be questioning, who would still be concerned, who would still be searching. So if I can be transparent, and I can help my patients to realize why it would be important for them to be transparent if that was their choice, then absolutely I'm going to help them do so.
And I wouldn't doubt that your story has helped somebody, right? I think that all of us sharing makes people feel like I'm not alone with things.
Absolutely. That's what I needed to know when I was thinking about having bariatric surgery because I had known one person, my godmother, and nobody else. So I just went on word of mouth. But when I found people who actually had the surgery, I started to find a community of people who I could say, am I crazy for thinking this? Am I crazy for thinking that? But it was really nice to have people, oh no, I've been there. This is what you should expect here, there, and whatever. Everybody's journey is different, but we can expect a certain amount of, you know, sameness as far as surgery, rapid weight loss, and adjustment to life.
Yeah, because I mean, at the end of the day, we all still have the same emotions. They may just come out differently sometimes. Well, obviously, there's social media has become a big part of how we communicate with each other, and there is a growing bariatric community in social media. Have you seen any, positives, negatives to what is out there?
Oh, I've seen both. I think people like me who choose to be transparent about their stories, I think it's really important just to be able to know, okay, here's another testimonial of somebody who went through that. And it's good to see the people who have had positive outcomes and negative outcomes because you want to know, everything while you're going through it. Um, But I would say absolutely, like, to let people know what I've been through, where I'm coming from, and what they can expect. Obviously, everybody's journey is gonna be different, but if I can make a difference in one person's life today, that's all that matters to me. So, if I have to share a little bit, I share a little bit.
I know that, like, we're seeing, like I said, more people that are I think being a little bit more open with that, and so I hope that like that continues because I think it's a positive thing, right? That more and more people are. Sometimes it might be someone's like I don't know if anybody's listening, right? But they just never know who that one person. Like you said, if one person hears it, it may make a difference for them.
I know that when I was looking to have the bariatric surgery, not even plastics after that, I was looking for a community of people who I could ask, if I did this, if I went this route, what did you experience? And knowing that they were out there for me and I could gain, like, there were Facebook groups and things like that because we're going on like 10 years ago. Um, but
I still use Facebook.
there we go. But there were things like that that I used at the time that if I hadn't had those resources, I wouldn't have known anyone and I wouldn't have known where to go other than the doctors and the nurses. But it's different when you've been there, done that, and lived through it. It's different getting your information from that than just like textbook information. I appreciate both, but I'm glad that there were people out there for me who could anecdotally give me their information the way I can too.
Do you have patients that you've basically been with from before bariatrics, after, potentially if they're having plastics? Like, are you following people look for a long time?
I would say yes. The great thing about my private practice is that a lot of the people that I see now, they're with me the last, I would say, 3, 4, 5, 7 years, because I was able to bring a lot of my patients from my previous job. And it's wonderful to see, like, even people who I had started doing trauma work with, and they had noticed that a lot of how they protected themselves was putting on that outer shell. And when we did the trauma work, they no longer needed that extra weight, that extra tissue. So they were able to make, whether it was diet and exercise choices or bariatric surgery choices, they were ready to make choices to get themselves to the next healthy spot. I have had patients who have said, you know what, now that I've worked on this, now I'm ready to get the surgery. So I've seen people from just a regular mental health patient through bariatrics and through their recovery, both physically and emotionally. And it's been beautiful to see when people come into their own and they can put down the baggage that they literally carried with them with that extra weight. That's beautiful to see.
What happens when someone doesn't really spend that time, like with what you're doing with your patients, to really figure out the mental aspects? Because from my side point of view, I've seen people who've lost the weight. They've physically done great, but I can tell that they mentally maybe not really in the same healthy place. I guess my question is like, how do you help someone in that position?
Well, I tell all my patients that if you're going to have bariatric surgery, the surgery is going to do what it needs to. You are going to lose a vast majority of your excess weight. If you want to keep it off, that's where the lifestyle changes come in. Like, I can't tell you that just because you're having bariatric surgery that I have Cinderella's magic wand and I can bippity boppity boo everything away. I can't do that. But if you lose your weight and you make the lifestyle changes that you need to in order then to be able to keep those changes on a long-term basis, then that's where you have long-term success and longevity in your progress. And some people can, and some people, if they don't make the progress with their mental health, they'll notice, because with any bariatric surgery, you can regain weight. It won't be the 10, 20, 50 pounds at a time as before, but you can still regain weight. So if you're not doing the work that you need to do, the surgery will have worked, but eventually you'll just slowly reverse back to where you were because you're not doing anything different.
Yeah. And the surgery, while you said, like you said, it can be very effective and do its job. It doesn't do its job on us. So people, you need to do the work, make sure that you're mentally in a good place as well. Because I know I've had patients who've lost all the weight, we've done skin removal, and they still aren't happy. And it's just because there's still more work to be done beyond just what's physical.
Oh, I think if it wasn't for my own personal therapist, because I think between bariatric surgery to my last skin removal surgery, I think I've been like through 7 surgeries now. And I've told my own therapist, you're not going anywhere. Just because I do this and I make myself feel better and look better this way, I still have work to do. Even all these years later, there's still work that needs to be done. So I consider it an honor when people want to see me even before surgery because I'm like, okay, you're really taking it seriously because you know that your eating and your weight is merely a symptom of what you're actually dealing with. So I love when people come, especially before surgery. I'm like, yes, now we can really work.
We're starting on a great foundation, right? And
Yes.
like you said, then you know you're going to have long term good results, maybe amazing because you've really done all the initial legwork.
Hmm. Absolutely. And that's where you see a lot of them. Not that everybody who doesn't have therapy before surgery, not that they don't are that they're not successful. They are, but I've seen more success with people who have said, you know what, I know the surgery is only going to work on my body. It's not going to work on my mind. I have to work on my mind. And those are the people who come to self-awareness quicker and they make changes quicker and they have long lasting, long term, uh, I guess, results that come
Hmm.
quicker for them.
I love that. And I think that, yeah, I really do think it all starts up here first, right? And then the rest can come with it as well. If somebody was really interested in reaching out to you and talking with you, how would they find you?
Well, I do have a website. It's ibtcounseling.com. And on there, if you are not one of my patients and you're just interested, there's a button where you can click to book a consultation with me. And if you're already a patient, there's a button to click where you can just put yourself on my schedule.
Are you able to see out of state patients, or are you only able to see patients within Florida?
I wish. Right now, I can only see patients in Florida. For 2025, I am looking at getting licensed in Georgia as well. I wish there was just a national license so I
I
could
know,
just
I
work in
know.
all states. But I understand the need for the differences.
Yeah. And what is something that you are very excited for coming up this year?
Does it have to be about work?
It could be anything.
Okay. I am getting to take my 13-year-old daughter to Japan. We're going
Oh,
to
wow.
go for about almost 2 weeks, and we're going to go
Uh-huh.
to Osaka and Tokyo. And she is like, if she could have been born and raised in Japan, she would have preferred that because she loves anime, she loves ramen, she loves the Japanese music. She's on Duolingo all the time with Japanese. So I get to take her for about two, and it's just me and her. So it's a mommy daughter trip. So I get to take her for about 2 weeks. And me personally, I'm just excited that I think it is, yep, I'm about a week out until I make 2 years in private practice. And I am just so thrilled that the jump and the leap that I made, that I took to start this actually panned out because I love the work that I do. And I love that I get to do this every day with my patients and that it also helps to provide for my family. I'm absolutely thrilled by that.
Well, congratulations on almost 2 years, and I know that feeling that when you're
Yes.
just like, it brings me joy and I get to make a living off of it. How great
Yes.
is that?
Absolutely.
And if you're listening now and you are in Florida, please reach out to her if this is something you're thinking about, or even if you've already had bariatric surgery and you're struggling, because there's nothing like someone who will really listen to you and help you guide you to get to a better place.
Yes. Thank you so much for the opportunity to be on here, Dr. Rednam. It's
Well,
been a
thank you
pleasure
for
to meet with you
joining us.
today.
Well, thank you so much for joining with us. I hope the trip to Japan is amazing and everything your daughter wants it to be.
Thank
and,
you.
and thank you all for listening to this episode of The Confidence Doc. I hope you learned a little something. Tune in next week.